talk about colon problems and everything. I know that. But your gut is really your life source. Your gut is the one that processes everything.
We've been talking about different topics
Talk about the upper half. You said the esophagus, the stomach, and the small intestine. Everybody knows the stomach, everybody knows the small intestine. Sometimes they don't understand the importance of the esophagus. Talk to me about why esophagus helps. Yeah, your saliva has some of the acid.
Are you or your loved one being released from a hospital and wondering how you'll manage? Inform your physician that you want to go to Palm Garden of Ocala at 2700 Southwest 34th Street for your rehabilitation. Palm Garden provides pain management, post-discharge follow-up, diabetic care, psychosocial support, and so much more. Plus, they even offer outpatient rehab. This award-winning care facility has a team of licensed professionals dedicated to enhancing your independence. Call 352-854-6262 today.
Are you wasting time boxing up packages and going to the post office or the UPS store? Are you tired of not knowing what you'll pay when you get there? Just Ship offers pickup service and flat rate packaging and postage rates, which takes the guesswork out of shipping while saving you time and money. So quit wasting valuable time and money. Call or text Just Ship at 352-234-3840. That's 352-234-3840. Just Ship.
from the mouth to the beginning of the digestive.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious
A very important part of it, and good hygiene is important to maintain, to prevent any injuries or issues in the
How does one get good hygiene of the esophagus?
So basically, it's what you put in the mouth. So, for instance, people should go to the dentist at least every 6 months to get
Dental cleaning.
dental cleaning and brush the mouthwash 2-3 times a day. Brush the teeth after each meal, or we should brush our teeth every time we eat something to keep them clean. But
Well, I need a toothbrush for me at all times because I'm on a seafood diet. If I see it, I eat it. Well, because that's something people don't think about. I brush my teeth in the mornings when I wake up, and I brush my teeth in the evening before I go to bed. That's not enough.
no, well, it's average. It's
Right.
acceptable. In between, you can do mouthwashes, which does not substitute the brushing, and also flossing.
Yeah, I don't floss at all.
Hey, Doc, I got a question for you.
Uh-oh, Joe Martone is in the building. Somehow he snuck in.
Yeah, he snuck all right. I grew up, and my mom always said, brush your teeth and brush your tongue.
Correct. The importance of brushing the tongue is because the tongue has so many little areas that accumulates food and drink and debris and some metabolic process of our food. So we need to brush it to clean it out.
It has a lot of pores in it.
Correct. Those pores are taste glands.
Oh, yeah.
So
Was it
or taste buds.
four different things? Sweet, sour.
Sweet, sour, and salty.
It's all three. Never mind.
And,
I was close. I was so close.
I know that cigarette smoking does a lot to destroy
Correct.
the taste buds of your tongue.
Yes.
That's one. That's a good reason not to smoke.
Correct.
I like the taste of food.
Yes, and also brushing your tongue it allows you to taste better the food. Also decrease the bad odor of the mouth.
Wow. We have a phone call.
If you want to put the headset on, we have a phone call. Good morning. You're on with Dr. Torres for the VA clinic.
Good morning, and thank you for this program. A couple of years ago, I had my last colonoscopy, and my doctor told me when I hit 80, I would not recommend you having that anymore. You just don't need it at that age. What do you think about that?
Thanks for the call.
So, moving along to the colon area, the reason why is not recommended after 80 is because of the risk during anesthesia. But it's required. The patient need to have normal colonoscopies or benign polyps, and no history of surgeries. Patients with colon cancer history, they should continue to get scoped just for monitoring and follow-up.
Is the moniker of you need to do it at once you turn 50, you need to do it? Because I've heard now people are saying maybe 45, maybe 40.
Well, the current guidelines for colon cancer screening start at 45 in African Americans and Hispanics and 50 in Caucasians.
So when?
Till 80.
Till 80?
Until 80.
Oh, good. I get to get some more done.
Hey, look, here's the worst part of that. And doctor, I've had it. The worst part of it is not the actual exam.
Oh, no.
Because the exam, you're in anesthesia. Mm-hmm. The worst part of it is that stuff you have to drink the 24 hours before.
Yes.
The
preparation.
But
and away goes trouble down the drain.
I will tell you this. I woke up, and my doctor was standing over me as he woke up. He goes, "Are you lucid enough to talk to me?" I go, "Do I have to see you again soon?" He goes, "I'll see you in 10 years."
There you go.
So a normal colonoscopy with clean prep and no issues, no polyps, it is average 10 years, every 10 years. We started testing with stool testing called FIT testing, and the FIT testing is based on genetic material that detects blood in the stools and can let us know if the patient need to have further evaluation. Normally, if the test is positive, it is recommended to have a colonoscopy to find out where is the bleeding coming from. Once the colonoscopy is done, the gastroenterologists, they look for multiple things in the area, starting from the anal area all the way to the upper part or the right side of the colon, as long as the scope allow you to go, and they look for polyps, lesions, diverticula, which a lot of people probably heard about diverticula and polyps, and there are different type of polyps. You have benign polyps and abnormal polyps, which can are precancer or cancerous polyps based on the pathology. In some cases, if the polyp is too big, it can cause obstruction, and that's one of the reasons or causes of why sometimes colonoscopies are done. Right. Because the patient is having either constipation problems or problems with the shape of the stool and such, and depending on the shape, it's always good if you have problems with your bowel movements, you need to discuss it with your doctor, and even take a look. Even though we don't want to look at it, it's always good to look at them, because that will give you an idea of possible problems that are happening in your body.
Well, when they do the exam, do they always remove a polyp when they see it?
Yes, they need to remove. They usually remove them. Yes.
You brought up diverticula, and you always hear people say it's one of those common things. I got diverticulitis. What is diverticulitis?
So the verticulums are little pouches in the intestine, mainly they can be through all the GI system, but you see them mainly in the colon area. And when you see the picture of a colonoscopy, it looks like a Swiss cheese. Instead of holes, they're pouches. And that is because of a weakness of the muscle wall of the intestine. We have muscles also in the colon area, in the intestine. That's how they move the food and move the feces out of the body. Problem with them is when patients with diverticulum eat little seeds, peanuts, rice, corn, things very small that can cause obstruction, that creates a chain of reaction of inflammation. They can cause bleeding problems as well. In the worst case scenario, the diverticula can explode and then cause complications, and then the patient need to have a surgery to clean everything inside and cause peritonitis or a dirty abdomen. And
I one time I was working 2001 probably. I was working in the restaurant industry, and because I was there 90 hours, 95 hours a day, 95 hours a week, I ate horrible. I either ate what we had at the restaurant or I lived on ramen noodles with all that sodium and everything. And one day my stomach started hurting. And the next day it hurt a little worse. 4 days later, I'm doubled over on the floor of my house. The ambulance comes and everything. They take me. I had, because of the sodium buildup and everything, it had re-globbed up. The seasoning that you use had re-globbed up and had blocked my intestine. And I just thought, it's a stomach ache. And in 4 days, it went from a stomach ache to a serious problem that almost could have caused my death. Because I just thought, it's just a stomach ache. But if you feel a stomach ache or something like that, you should always go get that checked out.
Yes, sir. That's correct. And that's the importance of us. Everybody should take a look and see what's going on. You need to see. I know the topic is kind of.
Oh, it's full of shucks, doggone it.
Full of corn.
But it's always good to take a look of the color, the shape, consistency, because that translate a lot of things. People with there's some shapes are like paper thin, or rabbit colored rabbit balls, and it's always good to take a look and see what's going on and tell your doctor what's happening. If they're the color brown, black, no color at all,
lime green.
Green. So
that's if you're Irish.
Correct.
Okay.
That's not a good color to have. Lime green's not a good color to have.
Now, because I have diverticulitis, I was told drink a lot of fluids.
Correct.
A lot of fluids all the time. So you'll always see me with my jug here of water or my
cup.
My cup here with water, and 90% of the time that's water or the light stuff you mix in, because water after a while is water, so I have to drink something with a flavor to it.
No coffee, though.
I drink a lot of coffee. Well, not a lot of coffee. One day a week I drink a lot of coffee.
You average about 2 pots a day, right?
No, not anymore.
One day a week you do.
One day a week, before I even get here, I have like 5 cups before I even get here on Wednesdays. But the rest of the time, usually 1 cup a day, maybe. So I'm not a big coffee drinker. The caffeine will mess you up?
It does. Beside the stomach lining and increased acidity of the stomach, can also cause tachycardia and the sensation that your heart is pounding quick.
Yeah, that's caffeine does that?
Stimulant.
It's a stimulant. Yeah. It's the most abused stimulant on the face of the earth.
Yes, that's why people drink coffee to stay awake.
And all those energy drinks are all caffeine types.
Right. When you ask people what the 2 most abused drugs are on the face of the earth, they'll say cocaine and heroin, and actually it's caffeine and nicotine.
Really, doc? Not you, doc, the real doctor.
And caffeine is accessible to everybody. It's legal, it's everywhere. It's
so is nicotine.
And caffeine is in a lot of drinks. Tea, in sodas, in
now decaffeinated. Does that actually work? The decaffeinated coffee?
It tends to work for people with issues before.
So it's good to drink. Well, we're going to take a quick break because we've got to thank the people that helped put this on, if you don't mind. Veterans News is brought to you by Hires Baxley Funeral Services and Highland Memorial Park. Hires Baxley has had generations of families honor them with their trust and confidence. They believe it's because for the last 128 years, their team of caring professionals have established a reputation of serving families with excellence and compassion. Hires Baxley currently partners with the Boy Scouts of America Troop Number 72 to properly dispose of decommissioned American flags. They are also a drop-off location for programs called Cell Phones for Soldiers, helping to provide minutes that
Veterans
helping heroes home. Hires Baxley is located at 910 East Silver Springs Boulevard, or you can call them with questions at 352-629-7171. That's 352-629-7171. Information can also be found at hires-baxley.com. And Veterans News is brought to you by Bob Wine's Camellia Gardens and Nursery, 2610 Southeast 38th Street, right here in Ocala. When it comes to landscaping, Bob Wines has what you need. That's everything from small plants to large trees, mulch, fertilize, and so much more. Bob Wines will even deliver, plant, and guarantee their trees. Bob Wine's Camellia Gardens and Nursery has been keeping you blooming since 1952. If you've got a question, your thumb's a little brown, you want a green thumb, well, give them a call. 352-629-717. I'm sorry, that's the other one. 352-629-5766. That's 352-629-5766. Bob Wines offers 10% discount to veterans with proper identification.
Veterans Helping Veterans USA. Call 352-433-2320. We help veterans and their families with limited financial assistance, counseling, employment referrals, and a food and clothing bank. You can help in making a huge difference in the veterans' lives we serve by donating food, clothing, household items, or direct financial assistance. All donations are tax deductible. Veterans Helping Veterans USA. 352-433-2320. Thank you for your attention, and God bless America.
Dad's service to our country is something we're so proud of. He made a difference and set a great example. Now it's our turn to honor the sacrifices he made for our family and this country. As veteran specialists, Hires Baxley Funeral Service helps us celebrate Dad's life and can help